Hello, and welcome back to our Home Sweet Healthy Homes podcast. Happy National Lead Poisoning Prevention Week 2025. Here we are once again. And I remember a couple years ago when we started celebrating it in the city, it was when we first started this podcast. So it's really cool to think about full circle. But to introduce our guest that we have today, we have Katelyn Kirby from the Health Department. Welcome. How are you?
I'm good. Thank you so much for having me.
Yeah, exciting. If you could just introduce yourself a little bit, what you do, how long you've been at the Health Department, all that good stuff.
Yeah, so my name again, Katelyn Kirby. I'm a public health nurse. My title is actually Public Health Coordinator in the Quincy Health Department. I've been with the department since 2018, and a lot of what I do as a public health nurse, our job focuses on communicable disease investigations, community education, and we do that through collaboration with QCAP and, of course, QATV to release a lot of different topics. We also do recreational summer camp and body art facility inspections and collaborate with our housing and food inspectors. So that would be for elders at risk or children at risk in the community, or again, back to those communicable diseases, that would work with our food guys. And we also do sharps disposal for both the police and the library and residents as well. So it's kind of a lot goes into it. Not too sure what the call is going to be.
Yeah.
But a lot of it is just getting our residents the right resources they're looking for.
For sure. It seems that you guys get your hands full over there with all that.
Yes, certain times get quite busy.
Yeah, definitely. That's good to know. So, since it is Lead Poisoning Prevention Week this week, why do you think you guys mentioned how you do community education? So why do you think it's so important to make the community aware of lead safety and education, especially because Quincy is a pretty old community we have here?
Yeah, so that is one of the biggest things for Quincy. So the United States banned lead-based paint federally in 1978. This ban meant houses built after 1978 do not have lead-based paint in them, but 24% of houses built between the 1960s to 1978 have lead paint. 69% of houses built between the 1940s to 1959, and 87% of houses built before 1940s still have that paint in there. A large amount of the housing in Quincy was built before the 1940s, and an even larger amount of houses before 1978. So that is why it's so big in Quincy. And at this point, that paint that could be in the homes is over 50 years old. So that's when you start to see it chipping and really becoming hazardous to the occupants in that home.
Yeah, and for sure, and young kids especially, those under the age of 6, they love picking at those sides of the window sills and maybe those door jambs there where the lead could be found most frequently. Also, I think this is a pretty old statistic, but I think from a couple years ago, maybe in 2021, it was around 78% of homes in Quincy still had that older paint in there. So it definitely is something that, if you're a homeowner in Quincy, you should check out to see when your house was built or if they use that lead paint in there.
Yes, I actually do. As we go forward with the interview, I do have resources of where
Awesome.
to actually, who
Yeah.
you can contact to figure out what has been done with your house.
Yeah.
Because I have a 16-month-old at home,
Yeah.
and you think it's silly saying a child's chewing on a windowsill. It's not that far-fetched, I've found.
Yeah. Yeah.
So that's why it's so important to know your risks and know how to mitigate them to protect yourself and your family.
Of course. And I'm sure, as you're going to tell us later in the interview, it's pretty easy to figure out what your resources are and then go forward and see what you can do about it.
Yes, and I'll kind of clue in at this point.
Yeah.
Number one, the first thing you want to do is call the health department.
Yeah.
And we'll
There you
direct
go.
you where to go.
Yeah, you heard it here.
Yeah.
Call the health department. Yeah. So, could you talk a little bit about now that we know, or now that you just answered how important it is to find out in Quincy if you have lead in your home? Can you walk us through how the health department specifically gets involved, or at what point they get involved?
Yes. So, the health department. So we don't have anybody who is a lead inspector. Our housing inspectors also, they do lead determination tests.
Yeah.
So the health department, along with the state childhood lead poisoning prevention program, we enforce the Massachusetts lead law. So this law requires all houses that are built before 1978 and houses at least one child under the age of 6. They must be lead safe, which is usually done by encapsulating or abatement. And this requirement puts a responsibility on the owners to ensure that the home is lead safe. I'd like to say I was very fortunate enough to purchase a home in the past few years, and you do have to sign a form in regards to lead. Because if, even as a landlord, you can't have people sign off if they're aware of it, you're still liable if somebody were to get lead poisoning within your home. So what happens, the health department offers lead determination for homes built in 1978 that have that one child. It's a less comprehensive than the lead inspection, but if the results are determined to be positive, we require the homeowner of the property to take necessary steps to make the house up to code and up to that law.
Yeah, so you guys are kind of like that first step where they can check and see through that determination if they have maybe some aspect of lead in their house or some sort of lead, and then from there they can go get it abated, or you say encapsulation as well.
Yes, and I always love to say start at the health department because we also know the local companies that do that. So it's a good place to start because you can get all your resources in one place.
Yeah, for sure. That's what we like to say in our office too if someone calls. We may not know the answer, but we can definitely direct you to someone who may be able to help you out with your problem.
Yeah.
Yeah, cool. And so, as we've mentioned with those painting chips, you mentioned that your baby is like kind of picking at those a little bit. What are some of the health risks that can come from those younger children eating those paint chips or whatnot?
Yeah, so lead poisoning can be very scary, any type of poisoning, of course. But lead poisoning is known to have negative side effects on the brain, liver, and bones. In children, lead poisoning has serious and long-lasting neurological effects, including a decreased IQ and behavioral problems. Symptoms of lead poisoning include joint and muscle pain, difficulty with memory or concentration, high blood pressure, abdominal pain, mood disorders. Extremely high levels can also lead to unconsciousness, seizure, and death. And when you mention all of, it's really hard to pinpoint. So if you're going to the doctors with any of these concerns, it's hard for them to pinpoint. But one thing for parents that are listening, you can rest assured that when your child is going to the pediatric office, by this lead law, they have to be tested 3 times before the age of 3. And a lot of times when we get the calls, we're getting the calls directly from the healthcare providers saying this child had a high lead level test. Can you please follow up with this home to go out and refer this family? Yeah,
that's great to know too, in case you may not know your home is older, or you may not know, because some of the symptoms they're a wide list that it could be anything, and some of them, like the IQ or the behavioral problems, you may not know since they're on the younger side. So it is great that they're getting tested so often before they turn 3.
Yes, and there's so many different reasons a child could have those developmental problems.
Of course.
So it's hard to always fall back on lead, but again, I believe that because of that state law where your child's being tested, is extra security in looking out for your children.
Yeah, of course. That's awesome. And so a lot of this relates back to, since the lead paint was banned in 1978, what is that, over 50 years or so ago, this could seem like an old term, lead poisoning, and make sure you watch your kid if you have an older home. Do you think it's something that families still need to worry about right now, or do you think it's something of the past?
Because of the law and because of these mitigations, it has decreased in time, but it still poses a risk, of course. In 2023, the CDC estimated approximately 29 million housing units have lead-based hazards. So that could be lead-contaminated dust or deteriorating paint. So it's the basic thing you want to know is when your home was built and if it was ever treated before. It's definitely not something of the past. And if you have a child, even like a grandchild coming to visit, you need to kind of think outside the box to really protect those around you when they're coming into your home.
Yeah, something that we'll hear occasionally sometimes, they're like, well, I grew up with lead in my house and I'm fine. You made it out well, but definitely something to still think about.
Yeah, and I think with time too, that you hear that so often, we didn't worry about that. But nowadays, there's so much information out there, and we know all too well what this lead exposure can do to somebody.
Yeah.
So reducing the risk for your family and loved ones is always worth doing.
Yeah, and it's just as simple as either taking your child to the pediatrician where they can get tested, or even just giving the health department a call. I believe there is an online system where you can check and see if your house has got deleted, possibly.
Yeah, so steps you can, if you look on the City of Quincy Assessor's page, you could look at for your home to see what year it was built. That also goes for other communities. You can look at your city's website, assessors, to see when your property was built. But along with that, with knowing that information, you could also call the Childhood Lead Poisoning Prevention Program, and they should have information on whether your home had been treated.
Awesome. Yeah. So if you're curious and maybe you want to, do some digging if you're slightly concerned, you can definitely reach out to Childhood
Lead Poisoning Prevention Program.
There you go.
It's with the state health. You can look up Massachusetts lead prevention, and it'll be the first thing that pops up.
Awesome. So what do you think is the biggest myth or misconception about lead poisoning today?
So one of the biggest misconceptions is that lead poisoning can only happen to children living in substandard housing. And when I'm saying substandard housing, I'm talking about any dwelling that poses a risk to health, safety, and welfare of its occupants due to hazards. Could include inadequate sanitation, lack of running water or heating, structural problems, or fire hazards.
Yeah.
Lead poisoning can affect anyone, regardless of the location, socioeconomic status, and it can also affect adults, but it's more likely because children also, especially when they're young, it's called hand to mouth, so they're always... It's a good thing that they're doing it, but every object they touch goes in their mouth, whether it's food or not. So that's why the children are a little bit more risk. Again, I think back to that windowsill before I had a child. It seems so silly. Keep your child away from the windowsill.
Yeah.
They're a lot quicker than you think.
You have your hands full.
So that's also like people think, well, it couldn't happen to me. I live in a nice home.
Yeah.
It can happen to anybody. So that's a very big misconception.
Yeah, and it's, your home could be really beautiful, although it could be also built before 1978. A lot of the older homes, while they're beautiful and have so much character, they also could be filled with lead paint. So it's good to check out and see when your house was built, just to make sure that you're in a good spot. For sure. And so, as you mentioned, with those cleaning toys, because they're putting them in their mouth and whatnot, what do you think are some other steps that people can be doing?
Yeah, so other steps, you want to make sure that they are washing their toys. You want to make sure you're wiping down any dusty surfaces, removing your shoes prior to entering your home. God forbid, just from carrying lead. And you also don't want to be carrying everything else that's on the bottom of your shoes.
Yeah.
It really comes to picture it with a child crawling around my floors, you guys, just how dirty they can be.
Yeah.
And you can also running cold water prior to using hot water for a shower. And also preventing children from playing in or on soil. That it's kind of hard, because your kids, you do want them to be outdoors.
Yeah.
But if they are playing in the soil, definitely don't put it in your mouth, and make sure they're washing their hands prior to eating or touching their faces.
Yeah.
And then I always say this in every QATV episode, so I have to say it on a podcast too. You want to maintain your overall health, so a healthy diet, adequate sleep, to really just protect your immune system.
For sure.
But yeah, the number one thing is always just knowing your level of risk, though. So when in doubt, if you have young children at home, call the health department to come out for that initial inspection. I was told, I collaborated with the housing inspectors before I came here today. For renters, we would come out to do that test, and then it goes on the landlord to fix it. For a homeowner, if it's your home, you more often want to call a lead inspector rather than us. But again, when in doubt, call our department and we'll refer you what steps to take.
For sure. Yeah. And something here at in my office that we do, we use CDBG funds to remove the lead from your house. So it's going to be, for right now, a 0% interest loan. It can be deferred, 15-year, 30-year, depending on applications, income, and age. But definitely something to think about if you think you may have a lot of lead in your house. You can reach out to us as well. If you're a homeowner, like you said. Yeah,
and that's like one of the things with it is it can be very costly to remove it, depending on the area, of course.
Yeah.
But again, reducing that risk is very important. So you want to make sure you have the safest home possible.
Of course.
So we always recommend finding out your risk and following the law to mitigate that.
Yeah, and it could be costly, but it also could save your child as well in the long run.
Yes.
Yeah, so then how are you making sure all this information reaches the families that may need it the most?
Yeah, so a lot of outreach. So of course it's coming on to do certain things like this, like a podcast. We also work with our community partners such as Mana Community Health Center and Quincy Public School System. And again, that state childhood prevention lead program. And a lot of the education actually comes from the pediatric offices.
Yeah.
Because when you have a child, you have to follow up with a pediatrician. If you don't, DCF may get involved. So they're like, by the law of Massachusetts, it's a lot of the information is getting to parents through their pediatrician.
Yeah.
And a lot, I believe I said it earlier on this episode, but a lot of times we're actually getting notified directly either from the pediatric office, or we're getting calls from parents and they're saying, my pediatrician told me to call you because my child's levels were a little high.
Yeah, there's also a similar program, I feel like, from that CLIP agency, Get the Lead Out. Is that the state program with the CLIP agency that you mentioned earlier?
I believe so.
Yeah. Well, you can look. If you're listening and you're wondering, I believe there's one with the state as well, but you're going to have to do some research.
Yes.
For sure. Yeah. So we've talked about getting your house tested, or finding out when your house is built. Do you think that's the most important information that people should take when thinking about lead safety awareness and lead poisoning?
So that actually would probably be the place to start.
Yeah.
Because again, it's all about knowing your level of risk. So if you know you're in a home, and again, Quincy is an older community, so a lot of our homes are from the 1940s. So really just know your level of risk and just making sure your children are safe. And again, keeping them away from those windows.
Yeah.
That's another thing. You can look around your property, whether you're renting or you own it. Seeing chipped paint is kind of a red flag. So that's something, if you see that, again, just make the steps. You really just want to figure out your risk. So call the health department, whether we come out to do a lead determination test or we refer you to a lead inspector, that's the first place to start.
For sure, yeah. And after hearing all this information, how can, prospective people who are looking for a lead determination or think there's lead in their house, how can they reach the health department?
So our main phone number is 617-376-1275. You can talk. We have two wonderful, Michelle and Dylan will answer this main line. But they will refer to the housing inspectors who will follow up. And again, when in doubt, give us a call first because you want to make sure you're getting the proper resources. You don't want to go pay all out of pocket if there were resources there to help you.
Yeah, that would be tough.
So definitely call us at the main line. And then for the state health department, if you go on mass.gov and you look up lead on mass.gov, you'll find all their information.
Awesome. Yeah, great. Do you have anything you'd like to say before we wrap up this episode?
I just wanted to thank you so much for having us here, or having me here. This has been my first podcast. It's been a great experience. And I hope to be back in the future.
Yeah, definitely. No, we'll have to have you come on and talk about the boatload of things you said earlier that the health department does. We'd love to hear a little bit more about that in a later episode for sure. Yeah. Well, thank you so much. As always, all of the information and the numbers that she talked about, I'll put in the description below. So if you didn't catch something, don't worry. It will be down there. And feel free to give our office a call. You can call me at 617-376-1055 for any questions about our housing rehab services. But happy National Lead Poisoning Prevention Week 2025. So exciting. And thanks again.
Awesome. Thank you.
Have a great day.